Thank you very much. And as you enjoy your dessert and coffee, this is a part of the program. The first part is extremely special, and this part is extremely special. We are very proud at the Healthcare Chaplaincy to partner with a network of 14 premier metropolitan New York academic medical centers and community hospitals. Each of these institutions is committed to providing the finest in patient-centered care by caring for the whole person in mind, body, and spirit. It is my privilege to introduce to you this year's patient care honorees. In an era in which individual achievement and gain are all too often rewarded, it is gratifying to be able to honor 12 outstanding individuals who are being honored because they typify healthcare chaplaincies and their institution's core values of teamwork and service to the whole person. On a daily basis, all of you touch so many lives in unheralded ways that make a real difference. This is the highest form of achievement. Each person we will now introduce has been or will be recognized at ceremonies held within their own institution. I have been privileged to attend many of those events, and every one of them warms my heart. I thank all of tonight's patient care honorees for allowing our chaplains and chaplain interns to work alongside of you. Each of you, by your presence and work, is a gift and a blessing to all of the lives you touch. As I present our honorees to you, please hold your applause until the last person is introduced. Adele Adams. Oh, there you are. Hi. Adele, your spirit and kindness and love of nursing makes you very special. You always go above and beyond in your care for your patients at Lenox Hill Hospital and aspire to excellence in your coaching and mentoring as you lead by example. With your special talent for communication and your gifted sense of humor, you ease the anxiety of patients preparing for surgery. Adele, you are a compassionate caregiver in every sense of the word. Thank you very much. Mary Ellen Conk. Mary Ellen, as the Service Excellence Representative at Lawrence Hospital Center, you tirelessly support the whole organization as it strives to meet the needs and expectations of patients and families. On any given day, you seem to be everywhere. When hurricane winds blew, you were serving behind the counter in the cafeteria. When the winds of grief blew over a patient whose aged mother unexpectedly died 500 miles away, you brought roses to her bedside. Mary Ellen, you know what it means to care for the whole person, and you do it with elegance and generosity. Thank you very much. Sava Susu. Sava, as Director of Engineering, you embody the spirit, mission, and values at St. Luke's Roosevelt Hospital. You are recognized as a kind-hearted, compassionate, and empathetic person who is ready to assist anyone in need. As I recently heard at St. Luke's, a patient's family member had written that your singing while you cleaned the patient's room brought light to this individual who was suffering from a terminal illness. Sava, the Director of Engineering, may appear to be far removed from patient and staff concerns, but that is not the case with you. You remind us that caring is the work of everyone in the hospital. Thank you. Jean-Marie Julien. Jean-Marie, as the Chief Physician Assistant for the Department of Orthopedics at New York Hospital, Queens, your name is synonymous with astute and compassionate patient care. Your calm and caring manner, coupled with your own deep spirituality, has helped frightened families navigate more securely through the life-changing events afflicting their loved ones. Jean-Marie, you are a gift and a beacon of hope. Thank you. Dr. Mark Criss and Nurse Ann Culkin. Mark and Ann This is the first time we've honored a physician and nurse team with the Wholeness of Life Award. Mark, as the Chief of Thoracic Oncology Services at Memorial Sloan Kettering Cancer Center, you have a reputation as a most caring and compassionate physician. Anne, as a clinical nurse working collaboratively with Mark, you coordinate the care, quality of life issues, and education of patients with lung cancer. One of your patients wrote, "When my cancer diagnosis was made 20 months ago, I saw my future as a dangerous, violent, lonely black hole. I began treatment under your care. Since then, I have surprised myself with how vigorously I have lived." Mark and Ann, the way you, as a team, touch patients and their families exemplifies the very best that healthcare has to offer. Dr. Lucille Perota. Lucille, you have been a leader and mentor to the neonatology staff of Beth Israel Hospital for the past 20 years. Even though your patients are the smallest and the most vulnerable in the hospital, you care for these newborns and their parents with exquisite gentleness and evident love. Lucille, you embody the true vocation of the physician and teacher, modeling in word and in deed what it makes to make a person whole. Thank you. Diane Rosenstein. Diane, as the Director of the Department of Integrative Health Programs at NYU Langone Medical Center, you have led the way in promoting comprehensive care for patients who are experiencing anxiety and pain. As a social worker, you have fostered teamwork and have nurtured a culture of integrative caring among a group of talented caregivers. You lead with enthusiasm, compassion, and an infectious sense of humor. Diane, your generosity of spirit has touched those who you work with, and you continue to encourage them to do the best they can for all. Thank you. Joanne Tournier. Joanne. You have devoted yourself to the holistic care of patients, families, and staff, bringing together the best clinical practices and a heart full of compassion. At North Shore University Hospital, you have pioneered the Family Communicator Program, building a team of nurses, social workers, and chaplains to respond to the needs of patients and families with traumatic brain injuries. You save lives by increasing organ donation consent rates and help families make life-giving decisions that align with their core values. Through your leadership and hard work, you led the development of North Shore's primary stroke center. You helped patients who had lost social supports build new social supports. Joanne, we and your colleagues support you. Mary Ellen Zullo. Mary Ellen, your life and work are helping to define what it means to be a caregiver. As Physician Assistant Manager at the Hospital for Special Surgery, you are recognized as a driving force that helps your spine service team consistently provide compassionate and quality care to all of your patients. These notable achievements are matched by an exceptional kindness and warmth. You combine medical expertise with unqualified regard for your fellow workers and patients, and that has contributed greatly to the hospital's reputation for excellence. Tonight, Mary Ellen, we pause to applaud your exceptional care, provided from a very generous heart, and never with an expectation of return. Thank you, Mary Ellen. Sharon MacArthur. Sharon, you are a hope specialist. As Director of Social Work, you help residents and their families at St. John's Riverside Hospital to find new goals and rekindle their hope. Whatever it takes, whether you have to stay late, come in early, or buy a piece of equipment or clothing yourself, you are persistence personified. Families hold on to your business card, ready to call you whenever hope fades or falters. Co-workers say you are the most straightforward, hardworking, compassionate individual they have ever met. They call you a wonderful listener, an excellent clinician, and full of wonderful surprises. Sharon, you have set a high standard in treating the whole person. It is for this singular accomplishment that we celebrate your work tonight. I now invite Sharon to speak on behalf of all of her fellow honorees.
Thank you. Good evening. I'm most honored to be here tonight and to represent all of the 2011 Wholeness of Life recipients. I have worked in healthcare for over 35 years, and I believe my fellow honorees would agree that understanding our patients and families from multiple perspectives is the hallmark of effective patient care. Throughout my social work training and career, treating the whole person was guided by the philosophy of person and environment, also known as PI, which incorporates all aspects of a person's life in shaping coping style and determining how health issues may affect body, mind, and spirit. An understanding of the whole person is indeed the key to maximizing physical and psychosocial well-being. I have witnessed firsthand the powerful effect of teamwork. The team is not only comprised of clinical professionals, but includes all staff, the front desk, the dietary aides, the housekeepers, the nursing assistants. Our patients and families seek comfort from staff with active listening skills and who are without judgment, staff who demonstrate care and concern through a warm smile and gentle touch, staff who instill realistic hope, reduce anxieties, and diminish sense of being alone. Our patients and families need our help in identifying and maintaining a continuum of hope throughout a disease and treatment process. The chaplaincy services provided by St. John's Riverside Hospital have been instrumental in guiding our staff as well as our patients and families to attain the best possible patient outcomes. I am thankful for the work of all the honorees who are with me tonight, to all those who commit themselves to treating the whole person, and to the wisdom of healthcare chaplains. Again, thank you for this honor.
I got it. Ladies and gentlemen, once again, I present to you the 2011 Wholeness of Life Patient Care Honorees.